Hi guys, welcome back to the channel Dentistry at its best. So as per my last video, today I will be speaking about nose from the topic human anatomy, and I will be discussing the the arterial supply, venous drainage, lymphatic drainage, and the innervation of the nasal septum in two different videos. So in today's video, I will be giving you the quite small introduction regarding the nose, nasal cavity and the nasal septum, followed by arterial supply and venous drainage. In the next video, I will be talking about its lymphatic drainage and innervation of the nose. Also, I will be uploading some small notes, self notes written by me on my Instagram channel. So kindly check out the channel in the next 2 to 3 days, and you will be able to see all the required notes regarding this topic on that channel. So now coming to the topic nose. Now, as you all know, we have this nose and it serves two main functions. Okay, one is the respiratory function, which helps us to respire air, and the second is the olfactory function, which helps us in smelling. So the receptors of smell are placed in the upper 1/3 of the nasal cavity. Also, this is lined by the olfactory mucosa. Now the rest of the nasal cavity is lined by the respiratory mucosa. So if anybody asks you in any MCQ or anything like that, we have two main mucosas in the nose. One is the olfactory mucosa and the other is the respiratory mucosa. Now coming to the nasal cavity. So the nasal cavity extends from the external nares, as you all know, these are the nares, or the nostrils, to the posterior nasal aperture, and it is subdivided into two compartments, that is the right and left compartment, with the help of the nasal septum. The center part of this nose is known as the nasal septum. Now each half of the nasal septum consists of the floor, roof and the medial and lateral walls. Now coming over to the nasal septum, which is I think one of the most important topic, and it generally comes as a question in the general anatomy questions. So just listen to me what am I saying, and if you have any doubts, do let me know. Also, I will be uploading this arterial supply and venous drainage notes on the page, so do check it out. Now, nasal septum, it is a medium or the median osteocartilaginous tissue which is present between the two halves of the nasal cavity. Okay, median osteocartilaginous tissue present between the two nasal cavities. Now, on each side, it is covered by the mucous membrane and forms a medial wall. So, the nasal septum is formed of three parts. One is the bony part, the other is the cartilaginous part, and the third is the cuticular part. So, the bony part consists of the vomer bone, okay, and the other is the perpendicular plate of ethmoid. So, it consists of two bones. One is the vomer bone and the other is the perpendicular plate of ethmoid. Now coming to the cartilaginous part, it is formed by again two cartilaginous parts. One is the septal cartilage, okay, and the other is the septal process of inferior nasal cartilage. I am repeating again. One is the septal cartilage and the other is the septal process of inferior nasal cartilage. You guys have to be very, what should I say? Very much you have to listen all these terms and write them down. It will help you a lot. So now coming to the cuticular part. Now this is the lower end formed by the fibrofatty tissue covered by skin. Okay, now cuticular part is the lower end of the nose, which is formed by the fibrofatty tissue covered by the skin. Now it is known as the columella of the nose. Okay, so columella of the nose, this is the columella of the nose, which consists of a fibrofatty tissue and covered by the skin. Also, the septum has four borders. One is the superior border, then the inferior, then the anterior and the posterior. Now these borders will help you to remember all the arterial supply and all the venous supplies and all. They are going to help you remember that. So please remember these borders. I am repeating again. These consist of four borders. One is the superior, inferior, anterior and posterior borders. Four borders and two surfaces, that is right and left surfaces. Okay, so now I will be talking about the arterial supply of the nasal septum. So you will be seeing a picture on this video, and please try to remember it as much as possible. Also, I will be uploading the notes, so you can check them out from that also. Now, arterial supply of the nose. Now, arterial supply is divided into again 4 parts. One is the anterior superior part, second anterior inferior part, third is the posterior superior part, and fourth is the posterior inferior part. Okay, we are going to talk about all these 4 areas of the arterial supply. Now, anterior superior part of the nose of the nasal septum is supplied by the anterior and posterior ethmoidal arteries. Okay, anterior superior part of the nose is of the nasal septum is supplied by anterior and posterior ethmoidal arteries. Okay, now coming to the anterior inferior part, now that is supplied by the superior labial branch of facial artery. Okay, the anterior inferior part is supplied by the superior labial branch of facial artery. Now coming over to the posterior superior part, that is posterior superior part, it is supplied by the sphenopalatine artery. Now this is the main arterial supply of the nasal septum. Please mark this, it is the main arterial supply of the nasal septum and it is supplied by the sphenopalatine artery in the posterior superior part. Backside upper part of the nasal septum is supplied by the sphenopalatine artery, which is the main arterial supply of the nasal septum. Now coming over to the posterior inferior part, that means behind and below, posterior inferior part of the nasal septum is supplied by the branches of the greater palatine artery. Okay, now these are the 4 arteries which I have told you. First, anterior superior part, ethmoidal arteries, anterior and posterior ethmoidal arteries. Anterior inferior is by the facial artery, which is the superior labial branch of facial artery. Posterior superior is supplied by the sphenopalatine artery, which is the main arterial supply of the nasal septum, and posterior inferior is the branch of the greater palatine arteries. Okay, now there is one main question which is generally asked in vivas or something sometimes. What is Kesselbach's plexus, or also known as Little's area? Okay, now as I've told you about all these arteries, there are 4 areas of the nasal septum which is supplied by the 4 distinct arteries. Now in the anterior-inferior part of the nasal septum, what happens is all these 4 arteries comes and form an anastomosis. Okay, so this area is quite sensitive because all the 4 arteries comes and open up in this area and they form an anastomosis, comes and bind and all that stuff. So what happens is this anterior-inferior part or of the nasal septum contains of anastomosis between the septal ramus of the superior labial branch of the facial artery, like I told you, superior labial branch of the facial artery, branch of the sphenopalatine artery, greater palatine artery, and the anterior ethmoidal artery. Okay, this consists of 4 branches which come in anastomose. Posterior ethmoidal artery does not come in anastomose in this. Only anterior ethmoidal artery comes in anastomose. So what I'm telling again: superior labial branch of the facial artery, anterior ethmoidal artery, sphenopalatine artery, and branches of greater palatine artery. These 4 arteries comes and form an anastomosis in the anterior-inferior part of the vestibule, or you can say of the nasal septum. Now, whenever we talk about epistaxis, or whenever we say that our nose starts bleeding when someone hits us, or something happens to nose and sometimes it happens while you're sleeping and it starts bleeding. Sometimes somebody hits you and it starts bleeding. Then what happens is this area gets damaged. So that is why this is the main area which leads to the epistaxis or nosebleed in a person. So it has 2 names. One, it is known as the Little's area, okay, or it can also be known as Kesselbach's plexus. These are the 2 names of this area, and it is a very important area in the nasal septum. So please remember these arteries. It's very easy. Like I said, 4 areas of the nasal septum, 4 arteries, different arteries, and all these 4 arteries except for the posterior branch of the posterior ethmoidal artery, they come in anastomose in the antero-inferior part of the nasal septum, which forms a Little's area. You can see that in the diagram clearly. It's marked in the picture, or small orange shaded area is there. That is the Little's area, which is the main reason for epistaxis. Now coming over to the venous drainage. So as we know, if we are having an arterial supply, we have the venous drainage also. So now venous drainage, what happens is the vein present in the nasal septum forms a plexus, okay, which is more marked in the lower part of the septum or Little's area. So this whole venous veins form the plexus, which is mainly present in the Little's area, lower part of the nasal septum. Now what happens is this plexus drains anteriorly into the facial vein. Okay, remember this thing. The nasal septum drains into the veins of the nasal septum, forms the plexus, which drains into the facial vein, and anteriorly it drains into the facial vein, and posteriorly through the sphenopalatine vein to pterygoid venous plexus. Okay, so there are two venous drainage present in the nasal septum. First is anteriorly and the other is posteriorly. The anterior area drains into the facial vein, okay, and the posterior area drains through the sphenopalatine vein into the pterygoid venous plexus. So that's all in the video for today. If you are having any doubt, do comment on the section in the Instagram or the YouTube channel. And if you like the video, please like, share and subscribe the page. And stay tuned for the more videos I will be posting on various topics from the oral pathology, pharmacology and human anatomy. Also, if you want, I can post any topic which you want to get it clear from the final year dentistry books. Okay, because trust me, I love final year. It was on my tips, so ask me anything you want. I'm gonna post a video regarding that for you all help. Okay, so thank you guys.